Hello everyone, my name is Chelsea Grosjean and I'll be talking about sex positivity and safe sex. So what is sex positivity? There are many different definitions, but these are two of my favorites. The first being the view that the only relevant measure of a sexual act, practice, or experience is the consent, pleasure, and well-being of the people engaged in it or the people affected by it, and having positive attitudes about sex and feeling comfortable with one's own sexual identity and with the sexual behaviors of others. How can we work to be sexually positive? First, we must understand what safe sex is, what plays into it. We have to be open to learn more about our pleasures and the pleasures of our partners. We have to know sex is a healthy part of life and it's not disgusting or weird. We have to accept the sexual practices of others, even though it may not be something that seems normal to us. And we have to make sure that there's always affirmative and enthusiastic consent. And of course, accepting people for who they are through their sexual orientations or their lifestyles. Yes means yes. This is an example for enthusiastic and affirmative consent. Consent is not only verbal. You can give physical and emotional cues that play a part in sexual activity. Consent must be mutual and continuous. So avoid assuming that your partner will be willing to do any sexual activity just because they've done it in the past or because they've spoken about it. And of course, discuss with your partner what consent looks like from you, from emotional and physical cues. Don't forget that it is okay to say no. If you're not ready to be sexually active with your partner, do not be afraid to say no to them. Explain to your partner how you're feeling. If you're not in the mood, or if you want to wait a little bit longer, whatever the reason, make sure to communicate. It's always awkward to talk about sex with your partner, but it's very crucial. Before sexual activity takes place, make sure you get tested for sexually transmitted infections and make sure your partner is aware of your results, whether negative or positive. Ask if your partner has been tested for STIs. Ask what will be done to avoid STI transmission and pregnancy. Give and receive consent before sexual activity takes place, and set limits or boundaries if needed. It is very important to practice safe sex. You can practice safe sex by avoiding transmission of sexually transmitted infections and preventing pregnancy. To avoid transmitting STIs, you must talk to your partner about getting tested before sexual activity takes place. You can get vaccinated for some STIs, such as HPV and hepatitis B. And you also need to protect yourself by using condoms or dental dams. To prevent pregnancy, there are many forms of contraceptives that can be used, and you can also refer to family planning. Getting tested for sexually transmitted infections. You can visit your school's health center for information and resources. You may also talk to your healthcare provider or visit a local health clinic, such as Planned Parenthood. The Centers for Disease Control website offers search tools where you can find clinics in your area where you can get STI tested. Once you say yes to having sex, that means you need to say yes to taking tests, because most people with STIs don't have any symptoms at all. So it is crucial that you and your partner get tested before having any sort of sexual activity. These tests can be fairly simple. For chlamydia and gonorrhea, it's just a simple swab of genitals or a urine sample. HIV uses a swab of the inside of the mouth or a blood test. Genital herpes that have no symptoms would have to be a blood test, but genital herpes with symptoms would just be a swab of the affected area of any breakouts that are showing. To test for syphilis, a sample is taken from any breakouts or sores, or you could do a blood test. For trichomoniasis, you can get a swab of the affected area, have a physical exam, or they can take a sample of your discharge. For HPV, with genital warts, it is just a visual diagnosis. It is very obvious and prominent to the doctor. And for HPV, that's cervical cancer, you can do a Pap test. And if your Pap test comes out normal, they'll do an HPV DNA test and a biopsy. If your test results are positive, don't freak out. There are many things that you can do. You can take prescribed medications, then get retested to be sure that you are free of the STI for future partners. You can notify your past, present, and future partners, make them aware of your condition so they can keep themselves safe as well. You can practice safer sex once you've finally been over the sexually transmitted infection. And if it happens to be incurable, you and your doctor can come up with a treatment plan. There are many different forms of contraception. The following birth control methods include barrier methods, natural methods, hormonal implants, intrauterine devices or IUDs, pills, the shot, abortion, emergency contraception, or sterilization. Barrier methods are methods that prevent sperm from reaching the egg. These include condoms, diaphragms, sponges, spermicides, or cervical caps. Natural methods is a way of preventing pregnancy through natural means, so no hormones, no barriers, nothing. This is based on fertility planning or withdrawal methods. Hormonal implants are implants that release hormones to prevent pregnancy. The main example of this would be Nexplanon, that's inserted into the arm. There's also intrauterine devices, or also known as IUDs. These devices are inserted in the uterus and they release hormones or spermicide to prevent pregnancy. Examples of this would be copper IUDs, Mirena, Skyla, Kylena, Loletta, and many, many more. Another form of birth control would be birth control pills. It is a daily dose of hormones in pill form that prevents pregnancy. Examples of this would be Alessi, Apri, Lavora, or Novum. There's also the birth control shot. This is a hormonal shot given every 3 months to prevent pregnancy. The best known is Depo-Provera. There's also sterilization. This prevents pregnancy through sterilizing reproductive organs. For men, it's a vasectomy, and for women, there's tubal ligations. There's also abortions. This is termination of pregnancy, often within the first 28 weeks of pregnancy. Depending on how early on, you can take a simple pill or you would have to have surgery. Lastly, there's emergency contraception. This is a birth control method used after unprotected sex to prevent pregnancy. Examples include Plan B, Ella, or a copper T IUD. Research has shown that there is an orgasm gap. So who is having orgasms? As you can see, the lowest is heterosexual women and the most is heterosexual men, with bisexual women, lesbian women, bisexual men, and gay men falling in between. This is where sex positivity becomes crucial. If we can communicate to our partners what we enjoy, what we don't enjoy, if we want to keep going, if we want to stop, we can possibly lower this gap. To reduce the orgasm gap, you need to be confident in seeking satisfaction. Don't be afraid to set limits and boundaries with your partner. Guide your partner. Show them what you like. Let your partner guide you. Listen to them. Observe their reactions. If they seem uncomfortable, stop. If they seem like they're really enjoying it, you're probably doing well. Ask for reassurance. Make sure you can verbally communicate saying, "Is this okay? Are you okay?" Be willing to try new things. You might not have done it before, but maybe they have and they really enjoy it. And lastly, you can incorporate oral and anal sex. For information on sexual health, STI testing, and preventing pregnancy, go to any of the following links. Thank you for listening to this presentation.